All right, this is a great question. 27-year-old woman, Gravata 1, para 0. At 28 weeks gestation, there's pooling of clear fluid in the vaginal vault and there's rupture of membranes. So we're concerned about a preterm pregnancy. And hemoglobin, HbA1c, is at 7.8, which is high. Diabetes and blood glucose as well as 210. Postprandial should be like above 120 is concerning. So this person's got diabetes. And what's going to be administered to reduce the neonatal mortality? The answer is going to be betamethasone or any corticosteroid. And let's talk about this. So if you have an infant around week 33, you're going to have a lot of development of dimethyl-phosphatidylcholine, which is lecithin production, which allows your surfactant to be secreted and produced by the type 2 pneumocytes. And we need that for the lungs to work properly. And if we don't have that, then the child's going to die. So if they're preterm, then you're at risk for not developing that surfactant because you just don't have time to grow it and develop it. And so the child's at risk. And so what you give them is a corticosteroid, which can pass through the phospholipid bilayer and it can create and spur those genes to work and create that surfactant. So that's the reason we give betamethasone or corticosteroids. Insulin actually is counterproductive because the diabetes caused in the mother actually makes us think of NRDS, neonatal respiratory distress syndrome, because hyperglycemia causes hyperinsulinemia in the baby, and the hyperinsulinemia actually counteracts the effects of the development of the type 2 pneumocytes. And so the child's actually going to have damaged type 2 pneumocytes or lessened type 2 pneumocyte production with insulin. So don't give them that. Magnesium sulfate is good for protection of cerebral palsy. Nifedipine is a calcium blocker, and that's a tocolytic. So these guys will actually prevent turbulin, it like prevents contractions. These guys would like prolong the delay, I guess, the birth, but it's not going to save you as much as like betamethasone would or a corticosteroid would, because that would actually solve the problem of the lung and respiratory development. So that's our answer. And if you want, you can kind of pause and look through these explanations. Less than production rises significantly, leading to greater than 2, which indicates lung maturity, because before it's going to be about 1 before 33 weeks. So it's all about that type 2 pneumocyte maturation and enhanced surfactant production. And that's pretty much it. Terbutaline, beta 2 adrenergic agonist that increases the CAMP and leads to smooth muscle contraction. So hopefully this is helpful. If it was, then go ahead and like and subscribe. That's how we improve the fetal survival rate in preterm labor.